I'm Dulanshi. Today I'm going to assess the cranial nerve number 2, 3, 4, and 6, which are based on eyes. So before assessing cranial nerve, we have to check doctor's order, and then we need to enter the room, and then we need to provide privacy, do our hand hygiene, and we need to introduce ourselves to the patient, and then we need to check two identifiers of the patient, and then we need to explain the procedure. So first, we are going to assess the cranial nerve number 2, which is optic nerve. To test cranial nerve number 2, we are going to do two tests. The first one is confrontation visual test. In confrontation visual test, we are going to test the client's peripheral vision, and we need to compare it to the examiner's vision. So we assume the examiner's vision is normal. The second test is the visual acuity test. To that, we have to use the Senna chart. First, we are going to do the confrontation set, the test. So, Mr. Amalsekara, I want you to close your right eye, and then I'm going to close my left eye, and then I'm going to move my pen light. Whenever you see the pen light, you have to tell me now, okay?
No, 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 no.
Okay, good. So let's try on the other eye. We are doing the same thing.
Okay. No, 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 no.
So the next test is visual acuity test. But to that test, we have to use the Senna chart. Um, Senna chart. To that, the distance between the patient and the Senna chart should be 20 feet. Before that, I need to ask from the patient whether he wear glasses or contact lenses. So, Mr. Amasekar, do you wear contact lenses or glasses?
No.
Okay. So, can you tell me the letters from top to bottom from the chart?
Okay. E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P.
Okay. Can you close your right eye and tell me, read it again?
Okay. E, F, P, T, O, Z, L, P, E, D, F, E, I think it's P, E, C, F, D, E, D, F, C, Z, P.
Okay, good. Okay, let's try in the other eye.
Sure. E, F, P, T, O, Z, L, P, E, D, E, E, C, F, D, E, D, F, C, Z, P.
Okay, great. So he read up to line 7. That means he has 20/30 vision. This means that he can see the same line of letters in 30 feet that a person with normal vision can see in 20 feet. Then we are going to assess the cranial nerve 3, 4, and 6. First, we are going to check the movement of the eyes. For this, we use the pen light, uh, and uh, and then I'm going to hold the pen light in front of the patient. Mr. Amalsekara, I want you to look at this pen light and don't move your head, okay? In here, I'm going to assess any involuntary shaking of his eyes. Okay. And next, we are going to see how reactive the pupils to the light. To do that, we are going to dim the light and ask the patient to look at the distance object to dilate his eyes. Then using our pen light, we are going to see how the pupil responds to the light. So, Mr. Amasekar, I'm going to look at your eyes, okay?
Okay.
So it's constrict. Okay. And next, we are going to check the accommodation. Have the patient look at the distance object to dilate the pupils again. And then take the pen light and slowly move towards his nose. What are we looking for this is that the pupil is constrict, accommodate, and cross while looking at the pen light. So, Mr. Amarsekara, I want you to follow this pen line, okay?
Sure.
Okay, all right. So now we can document that the pupils are equal, round, reactive to light in accommodation. So we did the assessment of cranial nerve number 2, 3, 4, and 6. Thank you.